Great. Thank you so much, Lee. And it's a pleasure to be here with all of you today. As you said, I'm the Deputy Assistant Secretary for Manufacturing at the International Trade Administration here at the Department of Commerce. I assumed this role on March 1st, coming from 2 decades in the private sector where I worked primarily in supply chains. So this is a topic very near and dear to my heart. Great to be here with you today and to talk about really just the critical importance of medical supply chain resiliency to the U.S. trade agenda. Today I'm going to discuss a lot of the challenges that we see related to supply chains and what we are doing to leverage trade in order to strengthen supply chain resiliency. And as a top line, more than 40 million American jobs depend on trade, and trade is critical to the success of many sectors of the U.S. economy. It is absolutely critical also to position U.S. manufacturers to be competitive in a global market. Here in the International Trade Administration and the Industry and Analysis Division, where I sit, our teams of industry and trade experts, we generate leading edge sector and market intelligence, including trade data. We provide critical advice on international trade and investment policies affecting the competitiveness of U.S. manufacturers in the global market. And we manage programs that promote exports of U.S. manufactured goods, and we also help to monitor and enforce trade agreements. We work very, very closely with U.S. industry, and together with that partnership, we develop and advance strategies, policies, programs to really position U.S. manufacturers to be at the forefront of international competitiveness. So we represent the trade interests of U.S. industry with other governments, in international organizations, and in various bilateral forums. And it's fair to say that U.S. manufacturers face a variety of trade restrictions and challenges to accessing foreign markets. In response, we seek to develop strategies and advocate directly with our foreign government counterparts to address these barriers to U.S. trade and investment. And this is what we call commercial diplomacy. So our work includes everything from engaging in trade negotiations to proactively address trade and regulatory barriers to looking at other ways that access to international markets may be restricted. As we all know, we're still in the middle of this pandemic, and COVID-19, really more than any event in recent memory, has highlighted just how important it is that we have resilient, diverse, and secure supply chains, particularly in the medical sector. So let me take a deeper dive into the medical device sector here just briefly. So U.S. medical technology companies globally sold $147 billion worth of products in 2018. And in 2020, U.S. medical technology companies exported $44 billion globally. The top export markets are the EU, China, and Japan. MedTech companies employ 372,000 Americans and indirectly support 2 million additional American jobs. Interestingly, of the 6,500 medical device companies in the United States, approximately 80% are SMEs. So that just gives you a sense of the industry that we're talking about here. And Commerce is really working diligently both across the US government and with industry to create strong and optimal conditions that support trade in these medical products, while also addressing the barriers that are there head on. So what are we doing in terms of supply chains? And on medical products in particular. A few that I'd like to highlight here. Commerce is co-leading the task force on supply chain disruptions together with the Departments of Transportation and Agriculture. We regularly, and by regularly, I mean multiple times a day, speak with industries who are affected by supply chain challenges. And we have really a team of sector specialists. It's been one of the highlights, I think, of my time so far is getting to know our sector specialists who are working with industry to devise solutions. We work across the interagency to assess medical product supply chains and support the US public health industrial base, whether that's with HHS or state or other agencies. And then Commerce in particular has played a lead role in writing the 100-day supply chain report for semiconductors. Some of which go into medical products and has created some challenges recently with the shortage. And we also contributed to the development of the other 100-day reports, particularly pharmaceuticals. And Commerce is leading a 1-year supply chain report on the information and communications technology sector, but also supporting other 1-year reports, including on the public health industrial base. So those reports were released on June 8th. They contain a variety of recommendations to address the risks associated with these key supply chains. The 4 reports looked at semiconductors, critical minerals and strategic materials, high capacity batteries, and pharmaceuticals, including active pharmaceutical ingredients. So I really encourage the committee, hopefully you've had a chance to take a look, but if not, please take a look at those reports. They really provide a good roadmap that now we will flesh out further with the work around the 1-year reports. On semiconductors specifically, I do want to note that we know that these widespread semiconductor shortages have affected many segments of the economy, as well, and including medical technologies. So to that end, on just recently on September 23rd, we've announced that we are creating an early alert system for industry. This is being led by the Department of Commerce, but we will work with the interagency, and it's meant to proactively manage semiconductor supply chain disruptions linked to key products, and that would include in the health sector. So we have an intake email address. It is covid_microelectronics_alert@trade.gov. And we invite industry, if you are experiencing a COVID-related disruption to your semiconductor chip supply, to please let us know. It alerts us in real time. It allows us to bring the resources of the US government to bear to see what we can do to help to address those issues. So again, an attempt here to recognize in real time some of these disruptions and to address it in real time where possible. Let me turn briefly to trade policy mechanisms. So some of the mechanisms that we're using to address supply chain resilience, as well as product shortages, would be things like trade facilitation procedures. How can we address issues related to paperwork documentation, customs clearance, licensing certification? How can we look at redundant product testing requirements? And then last but certainly not least, undertaking a close examination of Section 301 and the exemptions associated there. We know that there have been a very significant paperwork backlogs that have arisen during the pandemic that has really hindered the movement of medical product components and finished goods, and many persist even after 18 months into this pandemic. We also know that requirements such as local product testing has also hindered the movement, where testing facilities have not been able to keep up. In addition, the Section 301 exclusion process, we know that is a critical policy mechanism that is led by USTR. Just a note on that, USTR opened a 30-day window from late August to late September for stakeholders to submit petitions asking for extensions of health product tariff exclusions related to COVID-19, and USTR is reviewing those petitions now with input from Commerce. A separate petition process covering 549 tariff exclusions, not limited to health products, was announced earlier, and USTR is going to be releasing more details shortly about that process. I believe it is intended to launch on October 12th, next week. Talking about product shortages for a moment, we know that the US public health supply chain is going to remain vulnerable to future disruptions unless we really have some foresight here and really think transformationally about long-term investment. Systemic investments can be used to address medical product shortages. So one example of this is the Infrastructure Act, which passed the Senate on August 10th. It has many important economic priorities that, if enacted, will better position the United States to compete globally and will strengthen our supply chains here at home. It really is the US government's vision to protect the health and security of Americans by ensuring dependable supply chains for PPE, for medical devices, for medicines, and other public health supplies. This was described in the National Strategy for a Resilient Public Health Supply Chain in July 2021. And there's really 3 goals in that vision. One is building that diverse, agile public health supply chain and sustaining long-term US manufacturing that will provide resiliency for future pandemics. The second goal is to transform the government's ability to monitor and manage public health supply chains through stockpiles, visibility, and other types of engagement. And the third goal is to establish the standards, systems, and governance necessary to manage the supply chain and ensure fair, equitable, and effective allocation of resources. I do want to note that from a trade policy point of view, a key focus area for us here at Commerce is developing partnerships with other economies. We are participating in a number of different bilateral and multilateral dialogues, and conversations with other countries have included assessing which components and raw materials can be reliably and productively manufactured in other markets as well as here in the United States, because we know that while certain things need to be made here, not everything is likely to be made here. And so where do we want to near shore or friend shore some of those key components and materials? Just thinking here a little bit further, I should say that pretty early on in the pandemic, Commerce learned of many cases in markets around the world where the manufacturing of raw materials and components for medical products was either scaled back or was shut down due to lockdowns. And these problems do still exist or are rising sporadically in critical markets. And it could take multiple days and sometimes only after direct advocacy by Commerce for government officials in certain key foreign markets to grant waivers to those factories so that they could resume production. So these restrictions are challenging and something that we need to look at going forward to ensure that the manufacturing of these critical components and materials can continue. And I think I'd like to close here by noting one other aspect, and this is really a role for the private sector, and that's a rethinking of risk management for medical product companies. We've seen a number of situations where manufacturers relied on sole suppliers for critical components. And so when unexpected things happened, they couldn't get the quantities that they needed to meet public health or hospital demand. Many times they didn't have sufficient visibility upstream into their supply chains, not just to their second tier, but their third tier, their fourth tier suppliers, and didn't realize that they had sole source reliance there. So we know that a lot of medical companies are increasingly engaged in reimagining their risk and thinking about possible worst case scenarios, but we really want to encourage the private sector to think a bit more about supply chain risks and build that into their planning, into their mapping, into their procurement strategies, so that they also have just within their own supply chains a bit more resiliency, because it's not if a crisis happens, it's when. So let's plan for that. Let's build that